Now the idea is to talk about Earache, Otalgia, if I would prefer to say, which is more convenient to say. So let's talk about Otalgia. When we are looking on a patient with Otalgia, we'll need to think mainly about the differential diagnosis. Maybe this is the most important thing to understand how to evaluate this patient, how to treat this patient, and everything else. You can look for discharge and hearing loss and everything else. But let's talk about the most important thing, the differential diagnosis of Otalgia. So the most common causes of Otalgia are the middle ear infection, which is also called acute otitis media, and external ear infection, which is also called otitis externa. This is for acute pain, and for chronic pain, which is defined as more than 2 to 3 weeks of pain, the most common causes are listed here. TMJ arthralgia, a temporomandibular joint dysfunction, which is dysfunction of the temporomandibular joint, the joint of the mastification, if you want. I don't know how to call it, the temporomandibular joint. Maybe it's important to see it. This is a very common cause of pain around the ear, and sometimes the patient says that they have earache or otalgia, but uh, definitely they have TMJ arthralgia. You can see here the temporomandibular joint. This can be painful. It's right over here, and it can cause pain. There can also be clicking and sounds to this pain. Chronic Eustachian tube dysfunction, when the Eustachian tube is not functioning well, so the pressure cannot equalize between the air and the middle ear, so there is negative pressure. This negative pressure can cause fluid to, or this negative pressure plus the Eustachian tube, which is dysfunction, which is closed, can cause fluid to accumulate in uh, the medial, the middle part of the middle ear, and this can cause pressure. This pressure is referred to pain. This pressure is sensed as pain or fullness in the ear. Chronic otitis externa. Now, otitis externa usually manifests with itching, painful, especially when touching the pinna, the tragus. It's painful, and the ear can be painful to touch, the external ear. The canal of the ear can be painful. And here you can see a list of causes of otalgia. You can see here that there are causes of middle ear, there are causes from external ear, non-otalgic causes, and if we are looking at this, is we are starting with acute Eustachian tube dysfunction. What we said, maybe you will see something that hint you that the patient has Eustachian tube dysfunction, like popping when he's swallowing. When he's swallowing, it's opening but then close again. Signs that there is any underlying condition that can cause Eustachian tube dysfunction, like upper respiratory tract infection and congestion, allergic rhinitis, anything that can cause a closure or congestion in the Eustachian tube can cause Eustachian tube dysfunction. Okay, tympanic membrane on otoscopy may not read, but mobility decrease. It's quite hard. Barotrauma, I don't know if he is diver, if he was near some blow, maybe military something, shooting around him can cause barotrauma. It can cause significant pain, or diving or flying or something. Sometimes hemorrhage behind the tympanic membrane, sometimes perforation of the tympanic membrane. Okay, mastoiditis. Mastoiditis is quite, let's say, severe manifestation of the disease. It's a complication usually of acute otitis media, where the infection goes to the mastoid process. There are many. Maybe I can see you. I can show you this. Here it is. This is the mastoid process, and there can be an infection that goes from the media, from the ear, medial ear, to the mastoid process, and then can cause mastoiditis, which can be quite, you can see here, mastoid process is infected with infection and spus. It can be swollen, red, uh, tender to touch, and the treatment for this is usually IV antibiotics that should penetrate the BBB because this can complicate with a brain abscess. This can be complicated with meningitis. This can be complicated with severe manifestations. So IV antibiotics that can cover and penetrate the blood-brain barrier, like ceftriaxone, sometimes also vancomycin to cover also pseudomonas and things like this, or to cover MRSA, methicillin-resistant staph aureus, because it can also do the infection. If the patient get better, great, you can change him to oral antibiotics. But if he is not getting better in around 48 hours, it's maybe time to go to mastoidectomy to remove the mastoid process and all its pus and infection surgically. So mastoiditis is not very nice. So these are the signs of mastoiditis. Otitis media, as we said, acute otitis media, chronic otitis media, usually secondary to some obstruction of the Eustachian tube, the fluid accumulate and bacteria can go from the oropharynx throughout the obstructed Eustachian tube to the fluids in the ear, the medullary ear, and cause an infection, otitis media. We will see in otoscopy a bulging in the tympanic membrane, red tympanic membrane, usually in children because they are more prone to infection. Maybe it's because the Eustachian tube is more horizontal and more prone to closure in them. I don't know. Don't remember. Okay, so otitis media usually treated with antibiotics. External ear. Impacted cerumen of foreign body. You can see cerumen impaction, and it can be seen in otoscopy. Cerumen impaction can be seen on otoscopy. You can see here we see the difference between with cerumen impaction and after removal. You can see here there's why it's so okay, so we can see here the cerumen which impacted impaction of the tunnel, and here after the removal you can see the tympanic membrane very precisely and visually. So this is cerumen impaction. And if we continue, foreign body can also cause it. Local trauma is, of course, and otitis externa, which usually cause bulging or swallowing of the tunnel, of the ear tunnel, ear canal, and tenderness in the tragus, in the pinna when you are touching it. It's maybe very painful. The canal can be swollen, red, purulent, and discharge, itching. Sometimes it's mycosis or fungus that cause it, and then there can be white with black dots on it. Okay, so this is otitis externa, swimmer's ear. Patient, it's this called swimmer's ear because when water gets into the tunnel to the canal, it can cause an infection. Also, people or patients who clean their canal with, I don't know, cotton swab or things like this can cause an infection. There are theories that the cerumen is important for protection of the canal, or they cause an infection by a local trauma to the canal, and then staph aureus or other bacteria can get inside and cause an acute otitis externa. There are theories, but swimmers and those who use cotton swab or other things to clean their canal are more prone to otitis externa, and usually this is the cause. They will tell you they're using things like cotton swab to clean their canal. The treatment for otitis externa is usually, in not very severe cases, cleaning the area gently and removing the secretions and instilling drops with antibiotics, antimycotic, and steroids. Note that many ear drops contain neomycin, which can be ototoxic. So if there is any eardrum perforation, namely tympanic perforation, if there are any, so you need to use drops without neomycin, without ototoxic drugs. So ciprofloxacin there can be an alternative. And there are drops with ciprofloxacin or things like this, fluoroquinolone instead of aminoglycosid like neomycin. Okay, so we continue. There are non-otologic causes of ear pain, otalgia. Cancer of all around the place can cause it. Remember, very important thing, the innervation, the sensory innervation of the ear is also the innervation, the sensory innervation of the oropharynx, nasopharynx, and all this place. So I don't know, teeth at ache or toothache or tonsillitis or adenoiditis or oropharynx things, all this place can radiate to the canal, to the ear and cause referred pain. So note that the pain can be referred, and this is very important to remember from DMJ and etc. etc. So cancer in this area can cause it. Look for, I don't know, not healing lesion. Look for tobacco smoke, alcohol, which are carcinogens. Look for cervical lymphadenopathy, especially if it's non-tender, non-moving. Look for, I don't know, cholesteatoma. Look for a reduction in weight, which is a hallmark of advanced cancer, cachexia. Look for it. Look for signs of cancer. Look for B symptoms. Look for something. Look at their mouth. uh, Search for the unhealed lesion. Search for the unhealed, I don't know what, but look for cancer if there is no other reason. Okay, so infection can also cause in this area referred pain, tonsillitis, peritonsillar abscess. You know, tonsillitis with swollen lymph node, with swollen tonsils. Sometimes there is centoscore of strep, so look for uh, swallow lymph swallow tonsils and discharge. Look for lymphadenopathy. Look for fever. Look for the centoscore criteria. And for peritonsillar abscess, look for deviation of the uvula. Look for a bulging abscess near the tonsils, here, there in the oropharynx. Neuralgia, especially trigeminal neuralgia, which can be caused, for example, from blood vessels, superior cerebellar artery, for example, which is bulging and put pressure on the trigeminal nerve and has caused the neuralgia. So neuralgia usually is very short lasting, under 2 minutes of pain, lasting pain, lightning pain, very painful, that radiate in the division of the trigeminal nerve, lasting lower, less than 2 minutes, and trigeminal neuralgia. And then the treatment is carbamazepine and everything that, or surgery sometimes that we won't talk about here. TMJ disorder, you know that there are TMJ derangement without reduction, TMJ derangement with reduction. It can cause cliques. The treatments are problematic. Tell the patient if there are bruxism. Sometimes you can put a dental applicator. If they look for a teeth decay, because they have bruxism. If they are eating very hard food or chewing gum, advise them to stop it. But remember that the treatment for temporomandibular joint is better off with treating the cause that cause it, because all the arthroscopy and the surgeries for treating temporomandibular joint dysfunction straightly are not very successful most of the times. Of course, there are exceptions, but if you can find and treat the cause, it is better. There are red flags. Diabetes is a red flag because it can cause necrotizing or malignant otitis externa, redness and fluctuant around the mastoid, which can tell you that the patient has this severe mastoiditis, severe swelling at the external to the canal, malignant otitis externa, chronic pain, especially associated with head and neck symptoms, maybe cancer, maybe, I don't know, cholesteatoma. So look for it. And and treat the cause. This is the main idea. Treat the cause of Otalgia. This is the most important thing. Thank you very much. If there are any mistakes or correction, please tell me. This was an overview about Otalgia from Make Manual Professional Edition. Thank you very much, and that's it.